I'm Lieutenant Tracy Shear with the Omaha Police Department Child Victim Unit. I'm the lieutenant over the Child Victim Unit. With us today is also Colleen Roth. She is the Senior Director of Response Services with Project Harmony here in Omaha. We also have Judge Randon Rowland from Cheyenne County and a couple other counties, and Stephanie Beasley, the Director of Children and Family Services with DHHS. So we're going to do this, we're going to go through a couple of things today, and each one of us is going to present a little bit different things about our sides of stuff, and what we're doing with missing youth and looking at the needs of missing youth. So we identified a few objectives, and you can read that screen, but while you're reading that, I just want to put out there for anybody who doesn't know, the city of Omaha is approximately, I think it's a little over 500,000 residents right now. My police force, and I'm going to talk about it from my perspective, my police force is just under 1,000 sworn officers, and I have 26 years of experience as a police officer. My only experience is with Omaha Police Department. So when I'm talking, it is from the perspective of Omaha Police Department. I don't know how it happens in other jurisdictions, so don't think that the way that I'm talking about it, it happens the same way everywhere. And certainly all police officers have different views or different styles of handling things. And so I don't want you to think that I'm talking about any other police officers or anything like that. It's just from my experience. So a couple of things that we're going to talk about is we're going to flip back and forth a little bit between the non-court youth and court-involved youth. What we've learned is that the characteristics of youth that run away are essentially the same. There's usually a history of trauma, whether it's been investigated or not. If you dig, you can find that history of trauma. They usually have several prior contacts with HHS, and that's what we've learned, and you'll see some of that throughout this presentation. And then there's contact points with law enforcement too. There's usually family problems, and what I saw a lot of times is when you're looking through child abuse neglect reports to the hotline, there's evidence of dysfunction in the family. Maybe not abuse or neglect, but there's certainly fighting, domestic violence, there could be alcoholism, and there's just little things before these kids run away that you could almost pick out kiddos that might go on run from those child abuse and neglect reports. So what I like to do is I like to give a couple of examples, and I say that these two kiddos right here are my poster children. So just to give you a framework of where we're coming from, this was put together in 2018, so I do have updates to the side, but just so that you know, Omaha Police Department, there's basically a rule, a standard operating procedure that officers have to follow. When they take a missing juvenile report, they have to call my unit and advise us what they have, why the child ran away, and what they're doing to find that child or locate that child. And then we have to give them the okay whether they can go back in service or not. For every child under the age of 13, I have to be called directly because our officers have to stay out of service looking for that child. And that's not unique to Omaha. We've done studies comparative to other departments, and a lot of departments are the same way. So what we were noticing, or what I was noticing, because I was getting calls numerous times on the same kiddos over and over again, I was noticing that we would have these kiddos running away, and I was getting the calls all the time, and nothing was ever being done for these kiddos. So these two kiddos here became my poster children. Bella became a poster child because at the time of this picture, she was 14. She just turned 17 the other day. But at the time of this picture, she was 14, so this was just a couple years ago. She had 32 intake reports at the time. 32. She was 1 year old at the time of her first intake, and I believe that her first intake was over her family's living at hotels. grandma and mom would fight over who was going to have her, who was going to care for her, who could care for her. She was essentially homeless, except for bouncing around in hotels, and just not a good base of living. At 14 years old, she had 14 missing reports, and she was 12 years old at the time she first ran. And that's in Omaha. I don't know if she had run from a different jurisdiction. She's not originally from Omaha, so she could have run from a different jurisdiction without me knowing. And that first run is, that's a reported run. So if she had run before that first time, but nobody had reported it, I don't know about that. When we look at some of her history, she was sexually assaulted by a family member. She was also sexually assaulted while she was on run one of the times. She has her first arrest at age 14. At age 14, we knew she was a sex trafficking victim, but she would not identify as a sex trafficking victim. But she admitted that she was sleeping on couches, or she was sleeping with older men to have a place to stay. She had learned from her pimp that she could make money sleeping on couches, and so he was taking her places to do sexual acts. She was obviously a drug user. Some updates about Bella is she currently has 50 CPS reports. She has currently 17 missing reports, and that's from Omaha. Again, I don't know from other jurisdictions. And she's had 3 sexual assault reports. We recently recovered Bella, and by recovered, I mean she was stopped in a traffic stop, and at the time she finally decided to admit that she is a sex trafficking victim. She basically had another scare for her life and decided that this was the time she was going to talk to somebody, and we've been working with her diligently for the last month to build rapport with her. But she confirmed everything that we've thought since the beginning, as far as being put back in her home, that it wasn't a good situation, her mother is a drug user, and that she's been sex trafficked since she was approximately 14 years old, 13, 14 years old. Jeremy, on the other hand, Jeremy is the opposite side of the spectrum for me, because Jeremy was, in this picture, he was 12 years old, and I was getting constant calls on him. You can see that he's currently 14. At the time that that picture was put up, he had 7 CPS reports. He was 1 day old at the time of his first intake, and he began running at the age of 10. So at 12 years old, he had 18 missing reports. And I remember, I will never forget, it was Halloween night, 2017. I'd only been in my position for about a month, and I had my captain asking me, what are we gonna do about this kid? What's wrong with this? What's going on? What does this kid need? I didn't know. I wasn't prepared or trained or had any specialized training, because that's not what police officers have. We're not the social workers. We're trained to go look for them, find them, and return them home. Well, knowing his history, we knew he had a family history of drug use. I believe that's what his first intake was for. He got arrested at age 11. And unfortunately, it was a sad day. When I look back on it, it's a sad day for me, because when he got arrested, I was happy. Yes, now somebody can help this kiddo, because up until that point, I didn't know how else to get him any help. I have 2X on there. Basically, that means that he is a dangerous felon. At the age of 12, we recognize not a convicted felon, but he's had felony charges for a dangerous felony. For this case, it was he committed a robbery. He basically pushed down a little old lady and took her purse at the age of 12. And then we were worried about suspected gang involvement. Jeremy's currently 14. He has 20 CPS reports. He has at least 38 missing reports. I don't believe that he has any outside jurisdiction, so I think that those 38 missing reports are pretty accurate. And I have 20 CPS reports on there twice. Sorry about that. But currently, Jeremy is involved in a gang, an auto theft gang, or I say an auto theft organization of people in Omaha, and he is affiliated with a gang. Jeremy is actually a kiddo that I have gone to a committee here in Omaha that when we talk about juvenile detention alternatives, I went to a committee and I said, somebody please tell me what else we do. Because when you're looking at this and you have 38 missing reports, you have a kiddo who is stealing cars, who's committing robberies and all of that, when we're not supposed to be putting them in jail and we're not supposed to be removing them from home, I need alternatives. So these two children kind of will be the premise for everything that we talk about today. Why we're doing what we're doing. At this point, I'm going to turn it over to Judge Rowland so that he can talk to you about some of the statutes and some of the difficulties that we have with runaway children.
Thank you, Tracy. Good morning, everyone. The statute I have up there is Nebraska's detention statute, section 43-251.01. In July of last year, that was changed. Tracy, if you could go to the next slide, please. Thank you. Essentially now there are two options for detention, and they're really hard to meet. I can tell you from my experience, if you had a child that was in juvenile court, they ran, you generally issued a detention order that upon their being located, they were to be put in detention, and then we'd start working resources and get a place for them. That's really difficult to do now. As the statute says, and I'll let you read it there, a juvenile shall not be detained, the premise being that the legislature has decided they do not want children detained unless the physical safety of persons in the community would be seriously threatened, or detention is necessary to secure the presence at the next hearing as evidenced by a demonstrable record of willful failure to appear at scheduled hearings in the last 12 months. Well, if they're running for the first time that they've been in court, may or may not have a hearing scheduled at that time, we need to do something and we need to get options out there. But there are more limitations also on placing a juvenile in detention. Tracy, if you would hit the next slide, please. Thank you. Going into Tracy's examples, if a child is 12 years of age or younger, detention simply is not an option, even if they meet one of those other two requirements. The next slide. There are also several other reasons that cannot be used to place a youth in detention. Go ahead. To allow a parent or guardian to avoid his or her legal responsibility. I think that's the case where mom or dad just throw their hands up. We've done everything we can. We can't do anything else. Well, that's not enough. To punish, treat, or rehabilitate such juvenile. We used to have an excellent program at the Scottsbluff County Detention Center where we used it through probation, and we called it the 90-day program. It was very effective for some kids that we just could not find other placements for. Well, we lost our detention center, but even if that program were still in existence today, we wouldn't be able to use that. Okay. To permit a more convenient administrative access to such juvenile. Honestly, I'll tell you, I'm not sure what that means, but you can't do it. And the next one, to facilitate further interrogation or investigation. I think this deals more with law enforcement, where you have a serious felony, you want to place the youth in detention and conduct the interview and go from there. Simply can't do that. Okay, next one. There is kind of a last saving grace that's a possibility. I don't know of any judge that's ever used it. I'm not saying it hasn't been used. This has only been in effect since July of 2019. But if you've exhausted everything, the Office of Juvenile Services may provide placement in a detention facility, but that is only up to 7 days. And again, we're here to start the conversation because the legislature has made it clear we are not to be using detention except for a very last alternative, but we need to have some other options out there. So this presentation by the group here is to start that conversation. What other options, what other resources are out there? So with that, I'm not sure if it's Colleen or Tracy, but I'll turn it back to you. Thank you.
Okay, so what we're going to do now is we're going to take a little look at non-system involved youth. When this first started, we had to do a starting point. We had to come up with something, and when we started looking at the numbers and how many kids were running, we also started looking at what kind of services are available. And what was shocking to me is that there's no services available if you aren't system involved. But we don't want kids to be system involved, so how do they get services? So we decided, or Colleen actually decided for me, that Project Harmony here, our CAC here in Omaha, that they would take on the task of being my social workers, the extension of the police department, and start helping these non-system involved youth. In Omaha, I don't know, I think I'm missing a slide here, just so that you know, in Omaha in 2019, and what I did with the numbers are from 2019, January 1 to October 1, because we've had a couple presentations, we had approximately 3,500 missing reports. And then of those missing reports, here you can see the numbers here. In 2020, it was just a little bit less. I think it was 3,300. And if that slide shows up here later in the presentation, we can look at those numbers too. But we also broke down the ages. I used to have 10 to 13-year-olds all lumped together, but I started noticing recently, or over the past year or so, that kiddos are running earlier and earlier. Notice that I was talking about 12-year-olds. I could probably give you 5 or 6 more examples off the top of my head, and I'm distanced from the work. There's 2-3 levels below me that actually do the work, and I can tell you about 3-4 kiddos off the top of my head. There are 12 that are running and doing these things. But you can also see that the numbers go from 10 to 12 all the way up to 18, and no matter how long I've been doing this, I run these numbers every so often, and the scale always looks like this. We always have a gradual climb in the numbers and ages, and then we have a drop off. And I don't know why that is. If somebody wants to pay me to just do nothing but research on this, I'd love to do it. But I think personally is that, you know, the running starts early and then eventually it gets to be problematic. But then once a kiddo turns 16, parents start thinking that they can either fend for themselves, or they're close to being an adult, or they've just reported them so many times that it's not going to do any good to report them again. And so I think that's maybe why we start to see those numbers taper off after 16. And then we also look at the races. And I know that there's a disparity here between Black and white, and especially when we look at the population statistics. But you can see that the numbers that we take are not that far off. We're a little over 400 and then a little over 600. And when we talk about this, just remember that these numbers are based on total numbers of reports. And the number of kiddos that run is about, if I have 3,500 reports, it's about 1,700 kids. And so the difference in the kiddos and the reports is because we have juveniles that run multiple times, and it's really hard for me to separate out the two statistics. We have started taking new statistics, and you'll see some of those as we come through, but to do all that we have to hand enter, and we have to hand tally, and we have to read every single report and tease out the information. And it gets a little bit difficult, but we have been doing that since May. So then we also look at the sex and what we have here, male and female, and that pretty much stays consistent too. And when Colleen talks about their services, they say that they see about half and half. It's pretty much even split across the board who they're working with. I threw in this slide here because obviously when I put up Bella and Jeremy in the beginning, I talk about the number of their CPS reports. So one of the things that we were really interested in is looking at system status. Are we looking at more kids who are state wards? Are we looking at kids who are involved with the county attorney's office, meaning they picked up charges? And we include the Juvenile Assessment Center in that. So there could be some non-court kids, but the parents have gone to the Juvenile Assessment Center, or are they involved in both systems? Or not at all, because obviously the not at all are going to go, we need something different for them. We don't have services in place for them. We don't have funding that can help those non-system involved kids. And isn't the whole goal of all of this to keep those kids out of the system? So if we have over 400 kids that are running, and by the way, these are just individual kiddos. So this is just since May to October, individual kiddos running. So we've had 400 individual children run since May that are not involved in any system. And in my opinion, that is prime opportunity to start doing preventative work, to meet with these kids, figure out what's going on, figure out how do we keep them from becoming state wards, and how do we keep them from becoming in the criminal system or ending up at juvenile detention or having to go see Judge Rowland. That is really my heart and soul of this whole thing. And I just want to put out there that every presentation I do, it's A, to bring awareness, but B, also to learn. If people have ideas, this is a plea for help. Please give us ideas on how we can help these kiddos out. Funding is a big thing, being able to go to the kids and engagement with families, and you'll hear that from Colleen when she talks. One of the things about this, and I wasn't able to run the numbers today, is when we started actually teasing data out of our missing reports, one of the things I was really curious about is how many missing reports does a kiddo have before they start picking up charges? Because one of the interesting things was I applied for some grant money to assist with this work and was told that there wasn't a connection between kids who run away and kids who get involved in the criminal system, the juvenile justice system. Well, we can kind of see that there is. We've had 350 missing kids missing individual kids since May that are at the county attorney's office. So when we started doing that work, I ran some numbers, and at that time, and nobody can quote me on this, but at that time it was 3. The number was, it was like something like 2.9% or 2.9 runs before a kiddo will pick up a criminal charge. And that wasn't for status offenses. That was picking up a criminal charge like shoplifting, auto theft, disorderly conduct, something like that. So there's kids out there that if we get them from that first run before they're involved in anything, there's kids that we might be able to prevent some of this stuff happening, which is the whole premise of everything that we need to do. So this new data that we were looking at, it's a lot of, because doing these presentations, it's a lot of what we wanted to know. Also, I had ruffled some feathers when we were talking about these, because I put up that there's 32 CPS reports for a kiddo who's now being sex trafficked. And so we invited Stephanie to this also so that she could chime in about some of that stuff, and so that I wasn't making anybody uncomfortable. Because I understand it. HHS isn't necessarily equipped to deal with all of this either, but I've always asked, where there's smoke, there's fire. So when do we start accepting some of these things? So that's, Stephanie will chime in on that a little bit later. So what I created, some of this I had to black out here, but what I created in Omaha, when you have 3,000 missing kids and I have 1,000 officers to communicate with, that makes it very difficult. So I created a website that is just the missing juveniles here in Omaha. It's only shared with police officers on the street so that they can go in and they can look up a particular kid and see what are possible locations that kiddo might run to. And do we have any notices on that kid that we want officers to understand? Now, you heard Judge Rowland say that they took away our detention abilities last summer. And in Omaha, I feel like that actually started before the law changed last year. I actually feel like that started a couple years ago, where we weren't detaining kids as much just for running away. And so I feel like police officers might have become a little bit complacent. And what I mean by that is we got to the point where we found them, we just returned them home. No longer were the days where you found them and you checked to see if you were taking them to detention, or you called and checked to see if they were going anyplace else other than home. So I've had kiddos that have been located that have outstanding warrants that haven't been checked on. So there's more kids that are not getting the services they need. What we did with this was we've now made it a policy that officers have to check this when they locate a kid. And there will be, if there's any information that goes along with this kiddo, we put what's called an alert on there. So if the child is possibly being sex trafficked, or if we notice some of those red flags like domestic violence in the home, or this is the 3rd or 4th run at a very young age, or he's starting to dabble in the gang lifestyle or any of that type of stuff, we put an alert on so that the officers can say, oh, here's where I need to take them. And we've partnered with other organizations, and Colleen's going to talk about that a little bit, but that could include bringing them out to Project Harmony to have a discussion. So really what this all was born of, and you're going to hear Colleen talk about it, is my big idea was what would happen if the community could help engage these juveniles. Like I said, police officers aren't really trained to do that. We're not the social workers. So a lot of times we find them, we return them. We find them, we return them. And nobody really talks to the juvenile about, why are you running? What's going to keep you from running? So I asked Colleen, what would happen if the community helped? What if there was funding for these juveniles? And Colleen said, we'll do it. Let's figure it out. And so she started a program at Project Harmony. Before I go any further, does anybody have any questions up until this point?
So far, there's no question so far, just a comment.
Okay.
The comment says, it's interesting legislature creates laws restricting who can be detained, yet don't provide options to help situation. The juvenile system has shrunk over the last 10 years as group home placements, treatment group homes have closed, but nothing new has been created.
Right, and a lot of what I've been saying recently is there's a lot of unintended consequences when we make changes like that, and not understanding what this population is or where it comes from is part of a problem when we create a I don't want to say a system, when we create a policy that we don't have any place to help the kids who need help. Just as an example, we have another kiddo who's 12 and going down the same path as Jeremy, and we could not get him anywhere. We wanted to put him even into a staff secured, and we were told no, we couldn't do that because of his age. And he is now on his path to, he's on his path to felon status, gang status, felon status, and he's 12. And unfortunately, the police officers are sitting there going, well, how soon does he turn 13 so that we can put him in a secure facility? And that isn't the way that we should be looking at this stuff. But it takes education. And I'm probably one of the rare ones that truly understands what's going on behind the scenes and knowing that these kiddos need help, not just to be locked up somewhere. So with that, I'm going to turn it over to Colleen so that she can talk about the Missing Youth Services program that was created.
So thank you, Tracy. She gives such a nice introduction, but truly you can hear her passion and she's really hard to say no to. So yes, when she asked for our help, Project Harmony is a child advocacy center. We're one of about 850 across the country. Project Harmony happens to be one of the largest CACs in the country. We serve Douglas and Sarpy County and 16 counties in Southwest Iowa. Just to give you an idea of the numbers we serve, we do, pre-COVID, we were doing about 200 forensic interviews a month. During COVID, during September, numbers are back up. We did 170 interviews, so we're about back to normal. So when our core services with the Child Advocacy Center, for most of you who probably do know, is we assist law enforcement and child protective services in doing child abuse and neglect investigations. So our core services include forensic interviews, advocacy, medical, and mental health services. So when Tracy approached me about helping with the missing juveniles To say I was shocked was an understatement when we talked about the 3,200 missing juvenile reports. I, at that point, had been at Project Harmony already 13 years and never heard a word before this about missing juveniles. I knew OPD had one part-time retired missing youth detective that worked on those cases, and that was it. So the first thing we started to do is figure out who these youth are. So there was probably about 5 of us, because our systems don't talk to each other. We don't have a centralized system where there is CPS history and law enforcement history and juvenile justice history and court history. Several of us had to each look in the systems separately to figure out really who these kids are. And from that process, we figured out that half of the children, half of those 3,200 missing juvenile reports were kids that were already child welfare or juvenile justice involved, and about half of them were non-system involved kids. Like Tracy said, no one's talking to these kids about what are they running to or what are they running from. So we wrote a grant and hired a intake coordinator and a mental health therapist to start working our missing youth services program. We actually wrote another grant recently and got 2 more positions in August, a Spanish-speaking intake coordinator and a Spanish-speaking therapist. So we have 4 people dedicated to this program. We also provide, it's not a forensic interview, it's more of a clinical interview, but they get the full service that they would if they come to a CAC for investigative purposes. They still get advocacy, therapy, medical. In addition, we were trained in the National Runaway Safe Line Youth Prevention Program. So we run a youth group for missing juveniles. We created a companion caregiver group so that we could also bring the caregivers in and provide them the same education and support that we're giving youth. And in addition to that, we have a specialized multidisciplinary team for just missing youth, where we will staff both system involved and non-system involved missing youth. Go ahead. So how it works. So every day we get reports from the Omaha Police Department. They also give us DHS reports that are does not meet definition. So even if a child is threatening to run away, they will give us those reports and we have no problem reaching out to the family. We also have Nebraska Family Helpline, who will refer families to us. Our program is well enough now, because we've been in process for about 2 years, that we also have families just call us directly. So what we do with those reports, we get about 100 reports is what we review on the non-system involved youth a month. We will make warm calls to the caregivers, asking them if there's anything we can do to assist them or provide any services for their missing youth. We also have a process where OPD will flag youth on the website that Tracy talked about. So if a child is more high risk, like we know that they have a known mental health condition, or in the CPS intake it mentions that they are suicidal, or any other concern like that, or we haven't been able to engage the parents, Project Harmony has reached out and parents have said, no, we don't need your assistance, and we have this youth continue to run, OPD will put an alert on them where when Uniform Patrol finds them, they will automatically bring them to Project Harmony. At that point, we do have the opportunity then to interview the child about what it is they're running to or from. We do some safety planning. We call the parent in. We also interview the parent separately. We then offer therapy. We'll do a session with them together to try to negotiate. Sometimes it's not really a safe situation, or there's just so much discord in the family that a break would be nice to have 2 days or 2 weeks apart. Honestly, there's no funded respite care services, but we have gotten creative and been able to find a relative or a neighbor or a mentor that would take the kids overnight or for a couple nights until we could really engage with the family. We do have, aside from our 2 designated therapy resources to this program, we also have an in-house mental health therapy program in which we have 5 mental health therapists. So here's some of our missing youth data over the last 2 years. Overall for 2020, there were fewer reports in year 2 than program 1. I don't think that's necessarily true. I think Tracy could speak to that. But during year 2, we did have COVID the past several months, and I think we didn't have all the reports. And so I think that's why the numbers are lower. Interestingly, we still served about the same amount of youth in both years. When we don't accept, you can see these numbers are really low of youth we don't accept. Our criteria for not accepting youth is really if they are very low risk. So either they have no previous runs, or we're looking at their CPS history. There's been minimal to no CPS history. There's no concerns in the report. These are more kids that I wanted to go to the basketball game. My parents told me no, so I told them, so I left, but I really spent the night with my friend. There's really not a risk for us to accept the case. And the next slide, this is just another 2-year comparison of the total youth that we accepted of the reports we reviewed was 86% both same years, for both years. Not accepted, very low, again, right at 14% for both years. And for the youth that we were able to serve in the program, 24% for 2019 and actually 29% so far in 2020. Our numbers are through September. So what do we know about these youth? Like I said, there's no really centralized data system, so this was really a lot of work by individuals to figure out. But after we reviewed, I want to say 9 months worth of reports back in 2017, and put that data together, approximately 85% of the kids had prior DHS or CPS involvement. About 35% already had prior missing juvenile reports, and about 25% had prior juvenile justice history, which includes they were either formerly on probation or previously on diversion. What we really have found with this is that prior experience with the system really produces system fatigue for these families. So, you know, you have to really be understanding, like Tracy said, and take a deeper look at these families. I know some parents sometimes can really be seen as non-caring, or they really don't care. I don't think it's that. I think that they feel like they've tried everything there is to try, and they're completely helpless and don't know what else to do. So the message is kind of, take my kid. I don't want him anymore. Our sex trafficking data is really interesting. I said we do intakes both on the youth and the caregivers. We ask them both trafficking questions to screen for trafficking, and we have found it very interesting and consistent that 0% of youth will report yes to, while running, have you ever been expected to do anything for food, alcohol, drugs, or a place to stay, or money? They say no. But when we ask caregivers, have you noticed your child having extra money, clothes, a cell phone, gifts, or other things that you are not aware of how they obtained? About 30% of caregivers say yes, they have noticed that with their youth. So we know that these youth are being sex trafficked when they're out on the street. Next slide.
Yeah, just 1 second though, to
Oh,
let
go ahead.
everyone know. In the numbers that I shared earlier, we are currently, OPD is currently intensely looking at and working with 54 current kiddos who we believe are either being sex trafficked, involved in commercial sex, or are at very, very high risk to be sex trafficked. And I have 2 full-time investigators who go out and meet with those 54 juveniles on a weekly basis just to keep trying to build a rapport. So like Bella that we talked about in the beginning, they've actually been talking to her every day just to try and be that person who's there. But we have 54 that we've identified so far right now, just over the past, 6-7 months. So I just thought I'd add that in there.
Some additional efforts that we've made since we started our program at Project Harmony. Tracy and I both participate on a juvenile services runaway task force that's really has a lot of key community stakeholders on it, including school representatives, Omaha Police Department, several providers from the community that are really trying to focus on this population's needs and looking at those huge service gaps for non-system involved youth. Heartland Family Services also received a grant to serve missing youth, and it's gone well beyond missing youth. They serve kids that the schools feel are at risk for running, but they work with the immigrant refugee population. Their program is different than ours in that they really have kind of a street outreach part to their program where they're actually meeting kids on the street. They're actually going to families' homes. They're pretty much available 24/7. They go beyond case management and really become these kids' mentors. So it's a very small program. There's only 2 workers, and they serve mostly the Karen population, but they are out there to help the immigrant refugee population. Another service we added within the last 6 months, and we got the Child Saving Institute got funding through the Crime Commission Community-Based Aid Funds for a reception center. What we found is that when we did pick these kids up that had an alert, either after hours or on weekends, we had nowhere to take these kids. And we still wanted them to have the same benefit of someone doing an interview and kind of getting more information about what they were running to or from. So the CSI Reception Center was created for that. Interestingly, we've also recently, in the last several months, started accessing the Douglas County Mobile Response Unit. This is a partnership between the Omaha Police Department and Lutheran Family Services, who have mental health practitioners that will respond with police on an emergency with a family situation where there is mental health concerns. We've tried to get creative and utilize them. Say we don't get a family that is willing to cooperate with us when we do a reach out to them, and yet in the missing report, there are concerns for mental health or for suicide ideation, then OPD will initiate a mobile crisis response unit to go out together and kind of do an assessment with the youth and the family. And finally, the list that Tracy and I talked about, the list of it's usually about 80 youth a month that's on this list. They're non-system involved kids. And we send that to the schools. We also send it to all of the agencies that partner with us on the multidisciplinary team, which is probably about 20 key stakeholders from the community, just to really try to engage others in helping us find these kids. You know, if it's Girls and Boys Club, do these kids show up at your centers? Do you have a relationship with them? Can you try to figure out why they're leaving home? So we've really just tried to engage others in this initiative with us to try to find these kids. This is what the list kind of looks like. What it has on it is the child's name, date of birth, caregiver, school, and number of missings. Interestingly, we started this last year, didn't feel like we were getting a lot of response. We're meeting with Omaha Public Schools again pre-COVID, and then COVID hit and it kind of got shut down. But Tracy and I recently did a presentation to the Douglas County Threat Assessment Team, which has school resource officers, the head of the school resource officers on the committee, as well as different schools. And just this week, Lieutenant Scheer got a response that when she sent them the list, they sent it out, they separated it by schools, they sent it to the SROs at different schools, asked if they knew these kids, could they check and see if they were attending in person or remotely. If they didn't know the kids, could they start a connection with them so that they could really kind of assist in getting a relationship to help us with this population. The benefits of our Missing Youth Services program within a child advocacy center, this really was not anticipated on our part. We really just started it to help the police and these youth who were in need. But if abuse or neglect allegations occur, which many times there are abuse or neglect allegations, we can immediately switch from this voluntary prevention missing youth program to walking next door. We're co-located with Omaha Police Department Child Victim Unit, walking next door, letting them know, initiating that criminal investigation. We also have all of DHS initial assessment workers in our building, as well as the statewide hotline, so we can walk upstairs, make a hotline report, and instead of our intake coordinator meeting, we will initiate a child abuse investigation for sexual exploitation or physical abuse in the home or sex trafficking. Also, as I mentioned, both kids from, no matter how you come to the CAC, you have access to our full array of services. Another interesting thing that we found is a lot of times these youth, when we do get them, say if OPD brings them in, they often don't want to talk either. They're very shut down. They don't trust the system. But when we offer that medical exam, most kids want that medical exam. So if they've been on the street, maybe they have symptoms of a sexually transmitted disease, they want that medical. And once they work with our medical staff who are very well trained in child abuse, they can usually talk them into talking with our intake coordinator. So that's been a surprising point of entry for us into our program. And then another benefit is really through statute, we have the multidisciplinary teams, often referred to as the 1184 teams, but by statute we're allowed to share confidential information sharing, and it's required that CPS and county attorney's office and law enforcement and other involved parties in investigations come together and collaborate and review cases and share information. So we're fortunate to have that benefit at the Child Advocacy Center too. Some of the challenges, engaging parents has been really difficult. Like I said, we see a lot of parents who are just exhausted and appear to just have given up. The lack of funded services has been really critical. There are very limited services for non-system involved youth. Probably some of the main ones that we feel are critical to have are respite care, the crisis stabilization, mentoring, and secure mental health, which I know some of those are problems for even system involved youth. The lack of parental follow through for youth who want services. So some of those kids that we get in, that OPD brings in from an alert, will talk with the youth and they are very responsive and say, I would love to come back and have counseling here. And then we reach back out to the parents and the parents won't bring them in, and they're a minor and we have no leverage. So we have no way to get those youth back in here. So we'd like to really look at alternatives of how to reach minor youth in other ways when you don't have parent engagement. And then just a lack of community prevention programs and supports. Kind of as Tracy mentioned, we'd really like to see more available in the community that would prevent this from happening, where you did have more family involvement and services for families who were just initially starting to have problems. I would say we kind of look at our biggest success. We've had many runaways have behavioral and mental health issues, including suicide and abuse and neglect. Those kids were slipping through the cracks before, where now there is a program that we can find out what they're running away to and from. What our intended outcomes are, we do want to prevent juvenile justice and child welfare involvement. I put in here a study by UNO. They did a research study conducted over a year in 2016, and they interviewed all youth that presented to Douglas County Probation Intake. And of the 673 youth surveyed, 362 reported running behavior. Interestingly, I had a conversation with Kim Havakati the other day, and she told me they've been doing more data on the kids that are being charged as adults, and half of those kids have runaway behavior. We will also really want to decrease running behavior, improve school attendance, child functioning, and family functioning are really the primary goals for our program. I want to end just with a success story. One of the first youth that we saw at Project Harmony, Uniform Patrol found her. There was a missing report on her. They called Child Victim, and Child Victim instructed them to bring her to Project Harmony. When our intake coordinator interviewed her, she disclosed that she did have a plan to commit suicide. She was scared to go home because she thought if she went home, her dad would beat her. There were 6 other prior CPS intakes, some of which did include physical abuse by the dad. So we were able to get her in here. We did therapy with both parents, with her and with a brother sibling who also was having a lot of problems. which I also see as a real benefit, that we can provide those services to the entire family all in the same place, is really helpful. The final slide I have is her therapy graduation day. What we did was we sent out a notice to OPD, DHS, all of our staff, and they line the halls when a kid graduates from therapy. And as they walk down the hall, people clap and high five them. She was the oldest of 9 siblings, so her parents and her siblings were at the end of the hallway, and then we got them a cake and they had a celebration. So I guess I just like to end on that positive note, because we are helping kids that before were really slipping through the cracks. None of us are satisfied that it's enough, but that's one reason we're doing this presentation, like Tracy said, to see how we can work together to help resolve this issue. And I, with that, am going to turn this over to Director Beasley, who is going to talk a little more about the child welfare system involved youth.
So I didn't see where there were any questions. Leslie, did you
Okay,
have questions?
sure.
There are no questions yet.
Okay, perfect. So I'm going to turn that over to Stephanie.
Awesome, thank you. So Judge Rowland, Tracy, and Colleen, they've framed our need very well and solutions that are already underway. I really feel like we've had lots of wonderful discussion about the need for continued collaboration and service array development. We need robust solutions to address these needs. And Colleen also framed some of the challenges, I think, that when she talked about engaging parents who are exhausted and who've given up, and the lack of funding for services for non-system involved youth. I've appreciated very much Families First legislation happening at the federal level, and this shift to focus on community prevention programs that Colleen really identified as some of the barriers that we've had. And so these are early days for states that are implementing FFPSA, but I do think that that is, these are strategies that there is recognition at the federal and national level, and Nebraska is well underway in implementation of really focus on prevention efforts and building the well-being of kids and families in the community in which they live. And resources and focus on well-being can result in a reduction of missing youth, and we have continued work to do in this area. So the slide that you're looking at now are for the last year and about 4 months. These were our unduplicated count of children who were involved in the child welfare system here in Nebraska and who were missing. So well over half of these youth either left their home replacement and were found from a few hours to a few days, but a few of these youth have remained missing for longer periods of time, and each one of these youth are at risk. So the next slide really identifies, specific to Douglas and Sarpy counties, obviously a large urban area. This was really our range of days missing. And so you'll see out of the 34 youth who were missing during a period of time, we really do evaluate and look at it in range of days, from hours to longer periods of time where youth have been missing from their homes or from their placement. So the youth that are served in the child welfare system are at particular risk of sexual exploitation. So when we look at intersections for these youth in the child welfare system, I've got a little bit of national data here for review and consideration. So between 100,000 and 300,000 youth are at risk for commercial sexual exploitation in the US each year. Children who run away are at high risk of exploitation due to mental, physical, and financial vulnerabilities. Youth with contact with the child welfare system are certainly at higher risk than their peers. And research tells us that 70 to 90% of commercially exploited youth have experienced sexual abuse. So our available data in Nebraska suggests many children and youth who experience trafficking in Nebraska are unconnected, either due to experience with foster care, juvenile justice involvement, or at risk or currently experiencing homelessness. So the Children and Families Foundation here in Nebraska actually conducted a Connected Youth Initiative survey in April of 2019. And among unconnected youth aged 19 to 24, 50% report having no one to turn to in times of crisis. Additionally, 60% of suspected child victims of sex trafficking reported to our hotline were formerly involved with either state or tribal child welfare systems or the juvenile justice population. So once a youth is missing from our care, leaves home, even if they're in any type of services with us, we are focused on meeting the needs as soon as we find them and understanding the reason that the youth was missing. So the next steps once a youth are found are critical, which the first is the assessment of immediate and long-term services needed by the victim. Colleen outlined how critical the CACs are in this work and the support that they and the services that they provide. The next thing that we're looking for and really focused on is the coordination of trauma-informed and specialized services, particularly between where the child, which state the child was located in and where he or she is in care. Again, you've heard a bit from Colleen about the types of services that are provided. Then an assessment of the facility or the home safety from where the child went missing, looking at whether or not a safety plan is needed, and really to understand the recruitment of a child. Were they recruited for trafficking purposes? We know that traffickers have been known to target youth shelters, group homes, facilities, really for the recruitment of vulnerable children in the child welfare system. One of the things that we are looking forward to continuing to develop in this service array is, obviously I talked a little bit about Family First and that focus on prevention, true prevention services prior to formal interventions of the child welfare system and court. And additionally, we recently received a grant to focus on trafficking victims further. Obviously, our CACs are critical to the work in that grant. But this really is our next steps. Once we find a youth, are really determining what's the need and what services are needed, and how do we connect that youth to those needed services and reduce the risk for further exploitation. The next slide really outlines the duration of average missing youth, and this is just another key point that our average length of time that a youth has left their home receiving services from us or their placement is 15.4, but an hour is too long. This is something that we do track their duration, but obviously want no youth missing from our care, and we want to continue to make sure that the services are in place for youth once they are found as well. And so one of the things that we do, if you'll go to the next slide, is that we have recently in June changed our screening tool. We began to use a software platform in June of this year to identify youth who've potentially been trafficked. This new tool is called PAVE, Providing Avenues for Victim Empowerment. It's to do exactly what I just discussed, which was screening, assessment, and referral to services for youth who have been trafficked or are at a high risk of trafficking. So children and youth in Nebraska who are victims of human trafficking are underserved, and we need to develop a comprehensive coordinated response to trafficking. This is in part due to a lack of protocols to identify and assist trafficked young people within current systems. This is a critical need in Nebraska to develop this response. In recent years, there's been growing recognition that human trafficking of children and youth is a significant problem. Obviously, Colleen, Tracy, Judge have all outlined that need. And since 2012, a variety of government agencies, legislature, nonprofits, researchers, and advocates have worked on a series of reforms to enhance the recognition and response. I think we have a better picture of the scope of trafficking of children and youth in our state. We do know that system-involved youth are at a higher risk and need supports and services to meet their needs. National research on trafficking of children and youth indicates that unconnected youth are particularly vulnerable. And so CFS, I've appreciated very much, I've appreciated very much the opportunity to frame the need here and really the impact of the broader need, but those kids who are involved in the child welfare system and look forward to continued solutions around the prevention and community well-being models, where we're really looking at child and family well-being prior to their coming to the attention. I think Tracy did a really nice job of framing. Oftentimes, there are red flags that are being generated for kids and families before a child is identified and comes to the need, or they've run, or they're being trafficked. And I really think that our focus on prevention and those services that are being built could put Nebraska in a place where we are really the best in class services for prevention for the trauma of trafficking. So that I will ask if there are questions for us now.
Our emails are provided here. I'm sure that everybody feels the same way that I do. If you're afraid of asking a question here and you'd like to email one of us, or like I said, for me, this is always a plea for ideas, strategies. If you know a provider in the area that's willing to work with this, or willing to look for funds to assist with this, certainly reach out. I'd love to hear any ideas anybody has.
There is a question. It says, what should prevention look like?
Ooh.
So I'll start that. I'll take the first stab at it. You know, when we are looking at what we're calling thriving families, which is really this model of looking at child and family well-being, it's a framework in which that takes a community consensus and wrapping around a family, so that truly child welfare, juvenile justice services, Judge Rowland, we are not involved, right? So I think in terms of ensuring that there's a host of indicator from health to education to mental health needs, of housing needs of kids and families being met, so that there are not there's not a need for system involvement. And so when we start talking about prevention, often I think we sort of blur it with early intervention. Is when we start to see issues arise and a family maybe has some critical need. So I'm talking about true prevention versus early intervention. And I think that true prevention happens in the community with a well-being model. And Nebraska is well suited and to really lead the nation in this work. There's an initiative here that is Bring Up Nebraska. There are community collaboratives throughout the state that are really doing a nice job as community partners coming in and looking at what true prevention looks like. And so ultimately, it's these kids not coming to the need of formal interventions of the Child Welfare Agency.
I would just add to that, Stephanie. I know one of the things our Runaway Task Force has talked about is, could we have a resource center? Could we develop a resource center for this area and across the state that is for families? So whether it's your child struggling in school, or you're getting a divorce and your child is acting out, or your child was sexually abused, or regardless of what is going on with your family, there's a family resource center that you know where to go to access help, and they can make those referrals or provide those services that your family might need to assist you. But that would be a safe, friendly place that families could go and get help without Child Protective Services or law enforcement contact or involvement. They just know where to go.
I have a little bit different view. I mean, those are all great ideas, but for the past 3.5 years, my thing has always been outreach. We, in Omaha, anybody who works in this field knows how important this field is. And I think I hear it, you know, almost on a daily basis. If the public only knew. The thing is that what makes the news are gang shootings, are armed robberies, bank robberies, stuff like that. That makes the news. Not missing kids, Not necessarily child abuse, unless it's so severe that it's going to create shock and awe. So the thing is, here in Omaha is we have what's called a gang prevention program. And there are actually, I think, 4 people on OPD's payroll that if you suspect a kiddo is getting involved in gangs, those gang prevention specialists have carte blanche. They can walk into a school to talk to a kiddo. I can't do the same for a missing kid. First, I don't have the staff to do it. Second of all, I don't have an MOU with the schools to the point where I can just send somebody in to talk to that kid. And until we get to the point where we're really asking the kids or we're meeting the kids, how do we know what prevention really looks like? You hear in Colleen's presentation that there's a problem with parents who don't follow through with the services. There's also, if you look at the numbers for the number of reports that they look at, I believe it was in the 600s, and you look at how many are actually getting served, 29% of that. Where's the middle ground in there? And that's, in my opinion, going to be families who say, nope, I don't need help, the families who don't follow through, and it's those kids who are not getting the services that they need, and they're not getting asked, what do they need? And so one of my things is finding a way that we get an outreach program. And that's also where I talk about research. I'd love to do some research on how many intakes does it take for a kiddo to run away? Is there a certain type of intake? If I see 3 or 4 reports on mom being an alcoholic or mom and dad involved in domestic violence or something like that, is there a way that I can initiate an outreach program to just go talk to that kid and find out, hey, what's going on? Also, identifying services that the family or the kiddo wants to be involved with. So is there an organization out there that this kid would really like to be involved with, but they can't access that organization for whatever reason that is, but let's call a spade a spade. It's probably some socioeconomic difficulties, and these organizations don't have the money because unless you're court ordered to be there, they don't have the funding to deal with it. So there's a lot of things that I could talk about prevention all day long. Colleen could probably attest to that. But ultimately, there needs to be a starting point, funding available, somebody who can sit down and actually, one of the things that I suggested in the meeting yesterday is let's not only look at what we think will work, but let's look at what's not working. So when we talk to families who say, I've tried everything, okay, let's talk about it. What have you tried and what happened there? Because if that didn't work, maybe that's something that we put on the side. And if it's not working for 15, 16, 17 families, but we find something over here that does, I guess what I'm getting at is I think Nebraska has the ability to build evidence-based practices around missing youth because I don't think it's out there. We've done some research, Colleen and I have done some research, and this is one of, if not the first CAC to start doing this work. There's not even a handful of them, if they're even out there. I think Colleen said that she found one other CAC that was trying to do the same work. So honestly, I'll be very honest. Right now, prevention is whatever we want to make it, but we still have to structure it. We still have to research it, and we have to figure out what does it look like for a family that's not system involved. So I know that on one of our last calls, and I can talk about this all day long, so if somebody wants to interrupt me, go right ahead. But on one of the last calls, I asked Judge Rowland, what about a family who is non-court, that isn't following safety plans, that kiddo is asking for help and not getting that? So one of the other things is, do we look at legislation? Has something happened with our legislation that, yes, we don't want kids in the system, but do we have another unintended consequence by not wanting the kids in the system? I know that not wanting kids in the system, I know there's a stigma with it, and I know if you do the research that there are problems that are associated with that. But part of me wonders then, if there's a problem with that, what do we need to do to fix that too? I must have some type of fixer in me, wanting to always fix everything. So I don't know if anybody else has some ideas about what prevention looks like, or if there's any other questions. Leslie, are there any other questions?
There are no other questions, but there is a comment that says HHS has funding for street outreach programming. Another comment was just added. It says this broad ranging information is very enlightening and helpful. All of this information is critical to understanding the issues and finding solutions. Thank you for sharing such important information and for the thoughtful, diligent, and compassionate work you all do.
Thank you so much for that comment. Stephanie, do you want to comment on the HHS funding for outreach?
Yeah, so I'm curious, I obviously am a CFS, so I'm curious which division and which funding they're referencing. And I'll actually, one of the things that I'll say is that we do have, to Tracy's point, really an opportunity to understand what evidence-based practices are out there, and I agree to build it. And there are some really strong community collaboratives and partners and providers in our network who are already delivering other evidence-based practices. I think I agree so much that we can build what is needed. As far as, you know, I get into this, in my mind, this difference between prevention and early intervention. And I think we're well suited to build a solid prevention model, a well-being model, as well as an early intervention where we've identified evidence-based practices, risk for these families, that these are practices that are built on an engagement model with the family. But I think that we do have the opportunity. We obviously have a strong provider network, OPD. We have a strong leadership in this area that can help us build what is needed. And so as we look for different evidence-based practices, I too would, if there are evidence-based practices out there that others have found with research that are well suited to this model, I think there's an array, family-centered treatment, of other evidence-based practices that can help us get to that end. Can be built in concert with families and youth with lived experience at the table, helping us know what works, to some of the points that have been made earlier. But if there are ideas out there, we welcome that.
I think the other thing too is that, so that you know, Colleen mentioned the Family Resource Center, and that's not new. There are other states that have the Family Resource Center. I believe New Orleans and Colorado have two that are, I think they're nationally recognized. I don't quote me on that, but if you're interested in looking at what's called the MARC, multi-area resource center, down in New Orleans, and I can't remember the name of the parish. You're welcome to look at that. The thing that, coming from my perspective, is that when I look at those agencies that are out there, they're primarily focused on the system kids. They're primary. I think that JDI, Juvenile Detention Alternatives, has taken the spotlight, and so we still focus on how do we keep kids out of jail. Because I've sat in on some of these discussions, and it's all about not keeping them in jail, not processing them through the system as fast as they can process them through, and nobody's really asking the question about how can we start when these kiddos are 9, 10, 11 years old and starting to think for themselves and starting to realize that there might be an alternative to being at home. I know that Colleen had talked about, trying to find out, are these kids running from something or running to something? And we actually started keeping those stats as well. But what I realize is I think there's a flaw in those stats. Because what could start out as running from the family for whatever reason, running from their household, then turns into or morphs into running to something to get what they need. And so what one person will say, well, they're just running to get to their boyfriend. right? But did it start as something different? And so that's a really, really hard thing to assess. And we really, really need to figure out, how do we get to the root? How do we get to the very beginning steps? And I really think that there's so much more work to be done on this. And like Colleen said, we're only at about the 2-year mark. So I don't even think we've started to melt the tip of the iceberg on this issue here. But Leslie, have you gotten any other responses yet?
One more comment. Thanks for the helpful response in regards to the question that was asked, but no other questions so far.
Okay. I don't know if anybody has anything else, or do we just want to end 10 minutes early?
I say we're adjourned.
Okay. Way to go, Judge. Thank you very much.
Thanks, everybody. Have a great weekend.
Thank you.